Sir, the Communicable Diseases Agency, or CDA bill, will establish a combined body to oversee communicable diseases. It was one of the key recommendations of the government's COVID-19 white paper, and its formation was already alluded to in Health Minister Ong's speech during the related debate. I do not propose to revisit the arguments that were made by the Workers' Party then, but let me state at the outset that we support this present bill. We will nevertheless offer 3 additional suggestions on the scope and objectives of the new institution as it commences its service to Singapore. First, we believe that the emergency preparedness and response mandate of the CDA has to be sufficiently broad. This means that the institution should not only be focused on the most stereotypical public health emergencies, which has to do with disease outbreaks like epidemics and pandemics. The CDA should also regard disaster management as a key part of its scenario planning parameters. While Singapore, thankfully, rarely encounters the standard range of natural disasters such as earthquakes, tsunamis, or wildfires, flooding remains common in spite of advances in our water management infrastructure. And while communicable waterborne diseases such as cholera are thankfully very rare in modern Singapore, cases do sporadically arise, as they did in 2009. By a similar token, man-made disasters such as chemical or perhaps in the future radiological incidents would also potentially have associated disease transmission risks and have to be planned for. Perhaps more crucially, the CDA should also consider the implications of bioterrorist threats, such as smallpox or engineered virus strains, while MINDEF or the MHA would undoubtedly be tasked with how best to counter such attacks. The management of the aftermath of a bioweapons outbreak would logically fall under the scope of the new CDA. But the CDA should not confine its mandate to emergencies alone. Many communicable diseases are ongoing and possibly seasonal, such as dengue or influenza. Their routine nature should, however, not diminish their risks. After all, recorded dengue cases island-wide amounted to 13,564 in 2024. And in 2009, an outbreak of the H1N1 strain led to an estimated 270,000 infections and 18 deaths. Now, this would mean unfolding seemingly mundane tasks like the provision of educational and informational advisories on communicable disease prevention into the priorities for the new agency. The CDA should be leading public informational campaigns ranging from things that seem mundane, like annual flu shots, to prevention strategies for HIV. Indeed, it's sometimes the non-clinical aspects of such diseases, ensuring the undisrupted supply chain of masks and other critical medical supplies, or regulating appropriate safeguards for close-quarter living spaces, which was an acknowledged oversight in our COVID-19 response, that may be the most critical. We understand, of course, that many of these roles currently fall to different agencies and ministries. Dengue and Zika, for example, are overseen by the National Environment Agency, while the various strains of influenza are currently monitored directly by MOH. MTI will almost inevitably be involved in supply chain matters, and foreign worker dormitories currently fall under the purview of MOM. And research funding for vaccine research would be naturally administered by the NRF. Perhaps the MOS would be willing to explain how the different roles would be reallocated going forward, if indeed the new CDA will have frontline oversight over all communicable diseases. And if indeed the new agency will draw on expertise across the whole breadth of government functions, should clauses 51 through 53 of the bill, which currently limits employee transfers to only MOH and HPS, should it be more general. So the mixed tapestry of interlinked government agencies will mean a whole of government effort. And this, in turn, will mean the need to establish constant channels of communication and coordination insofar as infectious diseases are concerned. The new CDA must be proactive in this process. Most evidently, this would be within Singapore, both between government bodies, but also with allied institutions such as clinics and hospitals or university research centers. It will also entail coordinating the process of international knowledge and informational exchange, an important objective that the government itself acknowledges, and MOS Rahayu just alluded to, so that we do not necessarily reinvent the wheel or go down unproductive paths in our scientific and policy decisions. One common complaint during the COVID-19 pandemic was how information and guidance from MOH seemed to change by the week, and releases were often confusing. While we appreciate that the management of an ever-evolving disease is necessarily dynamic, it should not preclude the deployment of simple and reliable communication strategies. After all, successful communication and coordination was, directly or indirectly, a theme for 4 of the 7 main lessons from the COVID-19 white paper. With recent lapses in interagency communication surrounding the failed Allianz income deal, multiple MRT service disruptions, and the most recent BizFile NRIC leak, it behooves us to ensure that similar breakdowns do not recur in times of crisis when we can least afford it.